Health and healthcare could improve if everyone in the healthcare system could share information electronically in a private and secure way. A set of guidelines could make this vision of a connected healthcare system a reality. We call these guidelines the Common Framework.
When we have a more complete understanding of a patient's past medical history, then we make smarter decisions.
And having this information helps us make the best decisions possible for patients that are critically ill.
Instead of worrying about the paper, we just have the information electronically.
Computer technology can significantly improve healthcare when used to share information in a private and secure way. In some parts of the country, patients and doctors have the ability, with proper consent, to access patients' medication lists, lab results, and test imaging online.
We spend a lot of time and money in medicine duplicating tests that have been performed elsewhere. Information sharing gives doctors better information about their patients, and that leads to better care.
And with just a few clicks, patients can now schedule appointments, get referrals, and communicate with a healthcare provider over the Internet.
I was able to access both my new information and my old healthcare information and was able to compare them and found an error that would impact my future healthcare.
In fact, health experts say that timely authorized access to patients' electronic health information allows doctors and other health professionals to deliver the highest quality care, prevent medical errors, and even save lives.
We thought a patient was having a heart attack based on their heart tracing. By looking in the computer, we found out that the heart tracing was abnormal because of a prior heart attack. The dangers there was we could have very well given them a medication that could have caused harm, so we avoided that potential pitfall because we had information readily available.
While healthcare providers and patients benefit from secure and private health information exchanges in cities like Boston, this technology is not readily available everywhere.
We don't have a national architecture that allows us to send information. What if you start in Boston and you go to Indianapolis and you have an accident? Your medication list, your allergy list, your laboratories would be very helpful in your treatment.
Today, exchanging electronic information is central to how Americans manage their personal finances and participate in the workplace. Yet most Americans lack the ability to share electronic health information securely and efficiently with their doctors.
What we want is to have one common framework, an architecture and a set of policies, so that as a country we can do these projects in one common way. Not necessarily with the same technology or exactly the same approach, but one common way that allows us to work together instead of apart.
Working together, members of Connecting for Health, a public-private collaborative of more than 100 organizations, have created a set of guidelines to enable the exchange of health information within communities and across the country. Connecting for Health calls these guidelines the Common Framework.
The Connecting for Health Common Framework really offers a set of materials and resources for people who are ready to engage in information sharing in their communities that sort through some of the basic technical challenges as well as some of the basic challenges around how to address privacy and security.
And the Connecting for Health Common Framework has been tested in 3 different communities in 3 states, exchanging personal health information among these 3 locations, both securely and privately. Indianapolis and Boston were part of this groundbreaking data exchange. Both cities have sophisticated technology and healthcare delivery systems that were able to connect to each other and to Mendocino County, California, an area with small rural clinics and limited information technology.
It was very focused as a roadmap for the kinds of work that I thought we could do in Mendocino County to demonstrate that you actually can move forward incrementally from where you are. You don't have to have a giant project.
But what will it take for the successful effort in 3 communities to work nationwide so that millions of Americans can fully benefit from health information technology?
This work is a point on a longer continuum, and this is a first step, and we look forward to evolving it.
The organizations involved in Connecting for Health view security and the privacy of patient information as essential to successful health information exchange.
Privacy is foundational to everything that we do. We believe, too, that the decentralization of your data, keeping it in the doctor's office and the hospital, is very protective. There isn't a single database that could be compromised and release your records.
The Connecting for Health Common Framework is bringing the goal of nationwide private and secure health information exchange within reach.
It's a tremendous starting point for anyone who's looking to create a health information exchange. By participating in projects like Connecting for Health, I think we help make sure that the work we're doing in Indiana will fit into the national framework.
Having nationally recognized informaticians and clinical software developers describe a roadmap was perfect for us, because that meant we didn't have to invent anything.
By sharing this common framework for nationwide health information exchange, Connecting for Health hopes to enable healthcare providers and their patients to improve health and health care.
Imagine that you and your doctors have instant access to your vital health information, especially in an emergency. That's the future we're all working collaboratively toward, with trusted authorizations and privacy safeguards built in for all Americans.